So today I'll be talking about the pre-op epicrisis and surgical intervention for the topic head, chest, and abdomen trauma. So our patient is involved in a road accident with a truck. So our patient has multiple wounds. So as you can see on this diagram here, the patient has a superficial abrasion wound on the scalp. He has a fourth rib fracture which complicates into an open pneumothorax. He also has hemoperitoneum on the right hypochondriac region, as shown with the clinical signs of bruising over a large area. And he also has an open fracture of the right tibia. So in our epicrisis, the diagnosis for surgery is hemoperitoneum. It is indicated for life saving because of huge amount of blood loss. And this surgery is laparostomy, and the anesthetic will be given through inhalation, general, sevoflurane, and desflurane. The risk of the surgery is moderate due to infection that may occur. However, for thromboembolism risk, it is also moderate, and there is no contraindications for this surgery. So this surgery is planned to remove the accumulation of blood in the peritoneal cavity and prevent from occurring peritonitis. So we would do reinfusion therapy for this patient because in this case there is no rupture of the urinary bladder or the large intestine, and reinfusion is indicated during surgery. And for the risk of bleeding, we would also provide clotting factors as well as fresh frozen plasma. Surgery is not necessarily indicated for the fracture because it can heal on its own over a few weeks or months, and it is only needed to reapply the splint as well as changing the dressing. However, for the chest pneumothorax, upon the arrival of paramedics, first aid has been given with a three-way valve with a flap of escape of air. However, it is not enough for the treatment of the collapsed lung. So a chest drainage is needed to replace the first aid so that the collapsed lung can return back to the normal function. And air might still accumulate in the wound on the chest, and therefore the chest drainage will be on the patient for a few days until the patient recovers, as well as the patient has stabilized the vital signs. However, for the priority of the surgery, first we need to address the chest drainage because patient is not breathing properly as the lungs are collapsed. Hence, the first priority is always chest drainage before we can move on to laparotomy. And as for the last priority, which is placed last, is the fracture, which can then later be solved. As for the superficial abrasion of the scalp, uh, light bandage can be applied, and there is no indication for any surgery or any other steps for the abrasion.